think it was a very relevant and an interesting afternoon that we've had, which is discussion of care of her, which is the woman, because we've just celebrated the Valentine's Day on the 14th of February, and today we have discussed about the care of the woman, particularly during pregnancy and also after the delivery. Relevant very much in our present day scenario where families have become nuclear, where they don't have as much support as that was available before. Our grandmothers and mothers walked regularly, ate appropriately and ate correctly and had normal deliveries. Hence our country has become a 1 billion plus population, whereas now we have medicalized the condition of pregnancy, and the time has now again come back for us to unmedicalize the pregnancy or say that it is a normal condition, and hence we're telling women to eat for one, regularly exercise, listen to good music, and we now have to have a rethink about providing support to these nuclear families where it is just the husband and wife and having children and not having adequate support. The one suggestion that was made this evening was associations like India Home Care can look at the kind of population of 50-60-year-old women who are living in this society, who their own children are abroad and don't have a professional job, whether organizations like India Home Care can take them under their wing and provide them with some basic training so that these aunties can then probably go and look after 2 or 3 pregnant moms who've just delivered and give them the needed support, both physically and emotionally. Today the agenda was care of the woman during pregnancy and beyond. It is concentrating on the woman. And we've also extrapolated it. We thought we shouldn't just discuss about a woman's care only during pregnancy and delivery, but we should, yes, also we've extrapolated it and we said, yes, we should look after women before the pregnancy and continue to look after women. We've had a good, interesting discussion about menopause, which nobody in India talks about, when a woman has such debilitating symptoms when she's undergoing the change of life, is the term that we use for menopause. That we've decided that we should provide more information out there and this is to the women in the society, saying that yes, it is a normal physiological condition, but that you can have debilitating symptoms, but these symptoms do not need a pill, but can be you can find help with these symptoms, in dealing with these symptoms with simple dietary changes. After pregnancy, several. Don't eat for 2, eat for 1, eat healthily, regularly exercise, go see your doctor only for reassurance. But if and when you develop any medical problems, follow what your doctor's advice is to the T. Yes, you need to go on to the internet and garner more information, but there is also a lot of unnecessary information in the internet, and it'll be your trained professional doctor who will be able to tell you what is which of the information is right or wrong. Not just mostly thyroid problems. Yes, it's underactive thyroid that they're suffering from, and underactive thyroid it is unfortunately that one of the things that's not probably related to the lifestyle. Whereas if they're developing diabetes and high blood pressure, it is to do with their lifestyle changes, as well as being hereditary and stress, and just being Asian. We of Asian ethnicity are at an increased risk of developing diabetes and high blood pressure. Thyroid problem is a hormonal problem, and if they do not take it's usually the underactive thyroid, or what are called as hypothyroidism, and they need to take regular medication because it also affects their baby. And the requirement of the thyroid medication changes during the pregnancy, particularly in the first 3 months, the next 3 months, and the next 3 months, which is 3, 6, and 9 months. So then you need to have regularly the blood tested for the thyroid hormones and adjust the dosage of medication, which is again done with the help of an endocrinologist. You have to take the treatment because it has effects on the baby if they don't. And even otherwise, if they're not pregnant also, they need to take the treatment for hypothyroidism, because it causes them to have irregular periods, it makes them put on weight, it causes symptoms of excessive tiredness and sleepiness. So yes, you should. Like high blood pressure or diabetes, where you can tell them to moderate their diet and regularly exercise, then your blood pressure can be controlled and your sugar levels can be controlled. But the thyroid, you have to take a pill.